Hello, everyone. My name is Liz Skilton. I'm an Associate Director of Research at the Kathleen Babineau Blanco Public Policy Center and head of the implementation team for Whole Health Louisiana. We're excited to have you today for our Lunch and Learn for Whole Health Louisiana. WHL is a collaborative effort led by the Louisiana Department of Health as the public sector anchor and funder for the Whole Health Louisiana initiative. The Blanco Center leads the plan's implementation and evaluation. If you're unfamiliar with what Whole Health Louisiana is, Whole Health Louisiana is the state's cross-sector initiative intended to systematically address, mitigate, and prevent childhood adversity within our systems of care and support. WHL has 4 priority areas and goals: collaboration, awareness, workforce, and prevention and healing. With these priorities in mind, WHL's vision is to build a state where children, families, and community members across Louisiana are healthy and thriving, regardless of who they are or where they live. I'm going to turn things over to my colleague Quinn, who will be our moderator for today's session and introduce our speaker. So take it away, Quinn.
Hi, everybody. I'm Quinn, and I will be moderating today's webinar and all of our future webinars. And as part of this initiative, we are holding a variety of different activities meant to raise awareness and deepen conversation about trauma-informed care practices. Our virtual Lunch and Learn series touches on the workforce priority area of the Whole Health Louisiana plan and features presentations from industry professionals and subject matter experts. Our planned webinars are listed on the Eventbrite page that you all use to register for today's event. And before I introduce our speaker for today, I want to first mention that our ASL interpreter for today is Alyssa Gill, and you should see her pinned to your screen to view the interpretation throughout. In addition, if you are attending for CEU credits, please remember to complete the post survey to receive your credits. And for today's session, we are only offering nursing and social work credits. Okay, I'm going to go ahead and introduce our speaker, Sarah Berthelot, who is President and CEO of the Louisiana Association of United Ways, a collaboration of 7 local United Way organizations. She is a member of the United Way Worldwide Network Advisory Council and chair of the National 211 State Leadership Collaborative. With 29 years of nonprofit experience and 20 years with United Way, Sarah fosters the development of statewide impact initiatives which leverage technology, people power capabilities of United Ways, and other nonprofit partners to unlock scaled solutions for human service delivery. Sarah advances the work of the Louisiana 211 statewide network, serving as a statewide project developer for the aligned network of 8 nonprofit organizations. She also provides executive leadership to the Louisiana statewide combined charitable campaign. And in collaboration with United Ways throughout Louisiana and United for Alice, Sarah coordinated the introduction of Alice to Louisiana in 2016 and serves as the Alice Project lead for Louisiana. And with that, I'm going to go ahead and hand it over to Sarah, who will begin her presentation. Thank you, Sarah.
Thank you so much. It's a real honor to be here. I see a lot of familiar names in the list of attendees, so great to be with you. I'm going to take you through a series of information, and I'm now going to share my screen to begin my presentation. I'm going to just take a moment to get set up. Let's see. All right. So screen share, everybody can see. All right. So today our topic is ALICE, Asset Limited Income Constrained Employed. I want to thank the initiative for bringing this topic to the conversation today. Know that everything I'm going to share will be able to be is available in writing, and there's reference tools available to you should you want to revisit anything that we discussed today. Also, I'm at your service if you want to talk about it further or have questions in the future. I can always be contacted. So first, let's see. Let me go make sure I know how to advance my screen here. I'm just going to get my PowerPoint set up. Okay. So I am the president and CEO of the Louisiana Association of United Ways. Quinn did a great job explaining all of my roles, but I just want you to know that I'm here on behalf of the collaboration of United Ways throughout Louisiana. The Alice Project and everything that we'll discuss today is a result of a collaboration between United Ways serving all communities throughout our state. Um, Every United Way in Louisiana does work for Alice. If you would like to become more involved in the work that is helping Alice, which is the people that we're going to focus on today, know that your local United Way is a great place to get involved. And again, I'll go over all the websites to dig in further. This is a picture of the actual report that I'll be referencing today, and these are two digital links for you to access the extended report. We'll put in the chat these links so you can have direct access. And so please know that the content we'll share is open for your use. If you are working on any project that helps Alice, helps make life better for Alice, it could be a grant project, it could be a planning project, a strategic plan. Um, Please use Alice abundantly and the data, and I'm always will be of help to you. All right. So Alice, who is Alice? Alice stands for Asset Limited Income Constrained Employed. We all know Alice. Alice is the hard worker who waits on our tables, fixes our cars, cares for our elderly and young. I'm sure that you have already come in contact with Alice today. Some of you belong to Alice families right now. Some of you were raised by Alice. Many of you, if not all of you, are sitting directly next to Alice in your life. Um, let's see. I'm having a little trouble with my transitions. Um, Alice works hard each and every day, but does it faces hard choices to afford the basics. Alice has dreams for their children, and where we find Alice, Alice works hard, earns more than the federal poverty level, but not enough to make basic ends meet. And so I'm going to show you a budget now to go specific on where do we find Alice in Louisiana. Okay. All right. And so if you take a look at this budget, I'm going to get this off my screen. Taking a look at this budget, you can see basic line items. These items cover the basics, and what they do not include are gifts, saving for a rainy day, a college fund, dining out, haircuts, or unexpected needs as common as replacing a flat tire. You'll see that for a single adult living in Louisiana to afford these basics, one needs to earn $29,316 annually, and that equates to about $14.66 per hour. A family of four with two small children needs to earn $81,432 just to cover the basics. These expenses increased more than ever between the years 2019 and 2022. The increases equated to 11% for these basics, reflecting most acutely in childcare, food, and housing. You can see for the senior living alone that it totals 33,408. Seniors also experienced an increase during the same years of 2019 and 2022 of 10%. Now, in the Alice research, the links that I shared to the Alice research site, you can find household types way beyond the three that I'm referencing on this chart. There's all types of Alice households, and we might have households that are a family of 10. You can find Alice data at the research site. What you'll notice about this chart is that all of these budgets, which are the bare minimums, exceed the federal poverty level. The totals exceed the federal poverty level. And so that's where you find Alice earning below the basic survival budgets that are depicted here and above the federal poverty level. So in 2026, the federal poverty threshold is $33,000. For a single person, it's about $15,000. And so you could see the disparity, and it's no secret why so many people struggle to get access to much needed programs like SNAP and other aid programs because many times, if not all, they're based on a federal poverty calculation. Now I want to take a look at childcare. If you look on in the budget, it's so important for workers and their small children. And it's so important, high quality childcare is so important for the health and wellness of children. Alice families with children face increased challenges affording that quality. You can see in the chart that childcare cost has risen to about $1,400 a month for two children. This cost represents the largest expense for families needing access to childcare. And so that's why the conversation about providing aid, for providing families assistance to attain quality is so important for Louisiana workers and the health and well-being of their children. So where does this get us? I'm going to transition my slide now. In Louisiana, taking a look at the earnings of our households and applying the Alice budget, we're looking at a this is what we're looking at in Louisiana. And I'm sorry I'm pausing because I'm managing my screen. It brings us to a place where 30% of Louisiana households fall in that category where they earn above the federal poverty rate but below these survival budgets. Now, if you add that to the level of poverty in Louisiana, which is at 19%, we're looking at 50% of Louisiana households living below these thresholds, unable to make ends meet with their earnings, despite disaster assistance or any type of assistance available to them. It's important to note that every parish in Louisiana has Alice and people living in poverty. You can find people living below the Alice threshold in every community in our state, even the most small communities, if not, and most urban. And so you'll see that obviously 30 and 19 do not add up mathematically, but by rounding, the statistics brings us to a 50% rate of Louisiana households living below the poverty threshold. The first time I saw that, that was a little surprising to me. In fact, a lot surprising. And when we first released the Alice data in 2016, it was surprising to many communities. Communities equated a very low unemployment rate and thought that was an indicator of how well the people in that community, the workers of that community, were doing. But the Alice data gives us a glimpse to a multi-layered set of data that gives us a crisper picture of a financial well-being of Louisiana families, specifically Louisiana workers. So what's changed over the years? I'm gonna show you that now. So hardship has persisted in Louisiana through the years. This is the change that you'll see in these 3 years. And you might say, well, what about 2024 and 2025? Here's the good news. Every year we advance this data by 1 year. What we're focused on today is the most recent data that we'll be discussing today It comes from public sources from the year 2023. In just a couple of months, we will be advancing this data to 2024. We'll have the updated data set by the summer. And so we're working on that now. And so there is a slight delay in the Alice frame data versus the public sources. The Alice data is a compilation of dozens of public sources that are synthesized to create this picture. But you can see between the years 2021, 2022, and 2023, you could see the slight shifts in Alice households, with it peaking in the year 2022. We can all recall what the year 2022 was like. We were hit as a state with a series of hurricanes and the pandemic. Right before the set of these 3 years, we started to see a slight uptick and seeing more families rise above the Alice threshold. But we took steps back when our state faced a series of natural and pandemic disasters in Louisiana. So Alice can be found in every state in our country. Every state has at least 30% of all households unable to afford the basics. Unfortunately, in Louisiana, we have the highest rate of financial hardship in the United States, right next to Mississippi, who is right behind us at 49%. I unfortunately I have to share that we have the highest rate of child poverty in our state, in our country. And some parts of our state, especially in the Delta region, has some of the highest poverty in our country, especially households that are single parent households with children. In some parishes, nearly all of single family households live in poverty, which is well below the Alice threshold. And so it's something for us to pay attention to. It's something for us to acknowledge in our planning and our work. Okay. The trends between 2010 and 2023, the number of households in Louisiana increased by 8%. So the population increased. However, the number of households living in poverty increased by 19%, and Alice increased by 17%. Has a lot to do with the fact that our wages have not been able to keep pace with the inflation rate. And so our wages, for example, one of the factors is our minimum wage has been set at 7.25 per hour and has not changed since the year 2010. And so this has a great impact on our families. And we look at the inflation rates, but if we isolate the goods that an Alice household typically buys the most, such as food, supplies for their home, typical appliances that Alice would need for their home, the cost of those goods actually has increased at a much faster pace than the goods that are categorized in the general inflation rate. And so it's kind of another clue there. All right, let's see. Um, Now we're going to talk a little bit more about wages and workers. And I know that the workforce is a major priority for this initiative. And so essentially, we know that essential workers, there's insufficient wages for them to be able to support the needs of their family. Only 21% of working age people in Louisiana had a full-time salary job. And I'm going to show you a chart in just a moment that indicates that 44% of workers in Louisiana working the most common jobs that our economy holds live below the Alice threshold. Okay. And so this is an example, and I'm going to take time to go through this chart, but this gives us an explanation of what's going on. So let me just get my screen here set the way I need it to. So there are several factors that impact a household's ability to afford the basics, and I'm going to anchor the thoughts on this chart, including systematic barriers in our communities that are keeping Alice financially trapped, no matter how hard Alice works. The crux of the problem is the mix match of ever increasing expenses to the wages. And we just discussed that. To better understand this better, I want to take a look at a specific Alice household. Um, so when we think about in Louisiana, we learned that the household budget for that was needed for a family of four is 81,432, and you can see the first blue bar outlines that, covering the minimum for housing, childcare, food, transportation, healthcare, technology, and taxes. If we have a scenario, the second column, that combines the two most common jobs in our state, a personal care aide and a stock worker or an order filler. We see that this family, with both adults working, brought in 54,450. That is 28,000, almost 29,000 short of these basics. When we take a look at the poverty level, um, you can see this dilemma even further whenever this is the threshold that determines so many programs and eligibility. And so when you take a look at this and you consider Alice, let's say this family was able to make the threshold. What that means is there's no room for error. Um, they might be able, if a family can make 82,000 a year, they will be able to cover the basics, but there's no room for savings. There's no room for unexpected events and interruptions in their job. Everything has to go absolutely perfect, and they have to remain completely disciplined to make these numbers work. Um, what we see Louisiana families doing, and so many, I can tell you, I've talked to Alice, and they are a very resilient uh, group of people. They work hard, they want to make it work, and the way that so many describe the way that they make it work, it's like walking on a tightrope, and they use their earnings to engineer an ability to keep these expenses and these essentials covered. And it feels like walking a tightrope, and life happens. And what happens when unexpected events get in the way of their jobs, or a health event not only takes them out of the workforce, but places them into a costly medical event, these families can get easily knocked off their tightrope, and they are at risk of spiraling into a very significant crisis that could really derail a family's wellness and functioning and stability. Many of them, if knocked off the tightrope, are at risk of moving into poverty, and they have to climb back up. And depending on their support networks, it may take longer, and hopefully they can get back up. What we've learned about our state is there's so many resilient communities, families out there. Our culture, we understand what it means to recover from a natural disaster. Um, it's part of our way of life. However, we should not get too comfortable with the level of need that exists in our communities, and not see it as a norm, because it shouldn't be. Now, for a family, the personal care aide revisiting them, and the stock worker that makes a little under 53,000, they're short a little under 30,000 to cover these basics. What does that mean for them? What it means is they're working hard every day, they're working jobs, um, but they're having to make very hard choices between these essentials. And so it may lead to foregoing the medication and the health care that I need so that we can pay for the electricity. It may look like compromising on the quality of care, of childcare that my two young children can access. It may look like sitting at the kitchen table and determining how to time out payments on utility bills so that we can do it just in time, based on where the math adds up. And so, this is the conversation and the decisions that Alice faces every day. So, Alice is the hard worker who works hard to make ends meet, but are confronted with hard choices every single day. Um, and this chart really brings it to life for me. Um, I've talked to many Alice families about how do they make it work, and they oftentimes credit their family networks and their community networks the most, and how, stories about if there was no food available or there was no way to put dinner on the table, we could go to my parents' house and get dinner that night. And those little things make such a difference for an Alice family, the actual family network. Now, coming from a nonprofit where I work in the nonprofit sector, and so often the things that a nonprofit human service program attempts to do is fill needs that may be short term that help families stay stable or access a solution that they really need to make their lives better. And just to give you a couple of examples, is I work closely with Louisiana 211, which is a number that Louisianans can call 24/7. It's a short code number like 911, and they can call 211 and it explain the need that they have. And what happens is they reach a live call specialist that listens to their need and surfaces up solutions, programs, services that are available near them, and equips them with information for them to take action and to look into those forms of help further for their families. No secret that in a given year, the top five needs are always reflected in the basic budget that you see here for Alice. And so what's happening is Alice families are looking for help to meet one of the needs that they're having to forego. And so that I could see the correlation between a basic Alice budget and the top needs that Louisiana 211 helps with every day. Also, what you see right now is United Ways are working to help Alice workers file their taxes and access the tax credits that they deserve based on tax policy. An example is the Earned Income Tax Credit. So many Alice families can access that Earned Income Tax Credit. Our VITA sites help them to file and to access those credits and can even provide them supports to make the most of their tax credits. What we're hoping to do is that they avoid predatory lending practices to access those tax credits quicker. It happens a lot in Louisiana where people get to tax season and their tax return will help them with something they really need. It could be very essential, like an essential medical procedure. And they may be tempted to go to a predatory lending place and get a rapid refund, but it's extremely costly to that family. And so the VITA sites are working to support them to have free access and get all the tax credits they deserve. For a family, for this family, the personal care aide and the stock worker, the earned income tax credit could be the largest amount of money that that family can come into and do something to either pay down debt that's accumulated or address some family needs. It might be their annual opportunity to do so. So those are just two examples. Also, we have advocates that work year round to promote the importance of childcare supports to families so that children can access high quality care to support their working parents. Whenever a family can access this form of help, it eases the burden of their childcare cost, and their resources can be directed to rent, food, and other important basics. So those are just a few examples to go deep on the family scenarios of Alice, specifically in this case, the personal care aide and the stock worker. And so be thinking about questions that you may have about this, about the budget, and about this research framework. And so now I want to show you the top jobs in Louisiana. Um, so we're looking at the top jobs, the hourly wage, the average hourly wage based on statistics, based on public research. And what we see here is that of these 20 most common, 16 are paid less than $20 an hour. An hourly wage of $20 or less per $20 would equate to $40,000 annually if working full time. So 44% of these people that are working these jobs struggle to make ends meet. And so the good news is the headlines are telling us that there's major investments that are going into Louisiana that is going to build more jobs, perhaps higher paying jobs for communities, and that's really good news. And so, this chart will adapt and change as these developments come to bear. Also, we can't lose sight of the fact that technology and other developments like AI and technological capabilities will also change the makeup of these top jobs in the future. And so our ability to support workers in our state in adapting to the future workforce is incredibly important. And so it's something we're going to we're going to be tracking closely through this project of as things develop, what are our most common jobs? Where are, how many of these jobs support ALICE workers in rising above the ALICE threshold? Now, given that there's a lot of things happening now, and I have to say, many of them are inspired by this project, and employers are doing more to support ALICE. I have to say, our state sponsor for this ALICE work has been a sponsoring partner since the beginning is Entergy. Entergy takes steps to inspire corporations and businesses to do more for their workers. And so I want to share a few examples of what we're learning from our workforce in Louisiana and how they're supporting ALICE workers in their companies or small businesses. And here's a few ways you can see on the screen: offering flexible scheduling to accommodate second jobs and childcare needs, providing quality, affordable health insurance and other benefits, ensuring all employees earn a living wage. And so what we're seeing is businesses are taking steps to adjust their pay scale, bringing it above a certain threshold. And it's a pretty significant decision on their part, not required by law, but the desire to support their workforce. There's been businesses that this data that I'm showing you today help them to understand that if they pay their worker at this level, that the worker is likely to work a second job and it's not ideal that for the employer that happens because of safety reasons. And so it's been a good piece of work that's inspired some change. Also offering tuition, training reimbursements, and opportunities for career advancements, partnering with organizations to help address employer basic needs, and educating managers and supervisors about the challenge of Alice that Alice faces, just to name a few. All right, let's see. So in the actual report, what's neat about it is that there's a PDF report that you can access on one of the links. And in our report, we do a double page snapshot of every parish in Louisiana. The parish with the highest level of families living below the Alice threshold is East Carroll. As you know, they're found in the Mississippi, Louisiana Delta region in the northeast part of our state. The parish with the lowest level is Cameron Parish at 33%. And so, what these double page snapshots do is it goes through specific hyper local data insights about Alice and those parishes. And we also go down to the municipal level. And so, we will tell you in this report the smallest of communities. Elton, Louisiana, and Jeff Davis Parish, it'll indicate how many families in that very small community live below the Alice threshold. For some of you, this very hyper local view is very helpful to your work, and so we want you to know it's there. And it all of this will be updated again in just a couple of months, ready by the summer. And so this is what you'll see. And we also produce a specific survival budget for that parish, recognizing that in New Orleans, the housing costs will be different than the housing cost in Grant Parish. And so the chart I showed you earlier was a state roll up, but what we have for you in these parish pages are parish specific statistics that are appreciated at the local level. Many parish officials, governments, municipalities, nonprofits use this into their measurement work. Also, I just want to point out Alice can be found in rural and urban areas. You do see a higher level of poverty in Alice in the rural areas of our state. But you can see it's still very significant in both types. And if you're married with children in Louisiana, you're more likely to live in the Alice above the Alice threshold than other types of families. I want to point out that if you are a single female headed household with children, you're at greatest risk of living in poverty, with 57% living in poverty in Louisiana. I think it comes out to be 83% live below the Alice threshold. This has a great impact on those families and the children of those households. And so wanted you to just take a look at the differences of the different segments of our families, family types. And then one more thing I thought I'd like to share today, and we're going to share the link in the chat so that you can go right to it. We have something called the indicators of well-being in Louisiana, and I'm going to show you that these are the indicators of well-being that we have in our research center. For those of you, especially those that are really focusing in on the health of our families, this could be a rich data source for you. And what we do is we take a look at these indicators. We're able to measure these indicators, create heat maps, and compare it to the prevalence of Alice in a given parish. And so I want to show you an example of this. So here's the 50. You can find them now, and as part of our update that we're working on right now, all 50 indicators will also be updated by the summer. And so here you go. This is a heat map of an example of our one of our indicators focusing in on housing problems. And so the heat map on the right is an indicator of the prevalence of housing problems, and the indicator on the left is the heat map of families living below the Alice threshold. And you can see the similarities. You can see the similarities. And so, just to give you a little bit more information, I want to share with you about how we define housing problems in this indicator. And so this map shows you the map on the right, the percentage of households with at least one of the following housing problems: incomplete kitchen facilities, incomplete plumbing, overcrowdedness, cost burden greater than 30%. For renters, the cost burden includes rent paid plus utilities, but not telephone and internet. And what does this mean for Alice? It means safe and affordable housing is a fundamental need for families. Housing problems lead to challenges in the family. Poor housing conditions are associated with negative health outcomes, higher likelihood of infection, disease transmission, greater reliance on unhealthy foods, and these conditions also compromise employment and school performance. And so we talked about just a moment ago, we dug a little deep on the hard choice that Alice makes. And so if you're living in a scenario where you have this house, you're confronted with housing problems, all of those housing problems that we just listed, and you're juggling working your full-time jobs and making those hard choices between those basics, you can't help but to think and understand more about the complexity and the layers of stressors that come into play into the family's daily life. And so I know that part of what this coalition, this initiative does is focus in on children, trauma, and things that impact all the factors that impact well-being and health. And so you can, if you're, one thing that came to mind for me is that this Alice data kind of reminds us the layers of challenges that can exist whenever the earnings are not able to help with those basic essential needs. And so factor all that in to doing everything you need to do in your job and your daily life, and just the different challenges that these families face. And so I've just gone through a good amount. And so I'm going to bring you back to this chart to have you look at it one more time. This is the aggregate chart for the Alice budget. And so we call this the basic survival budget. And so when these numbers don't add up, you choose between these essentials, or you forgo these essentials. And so I just wanted you to take a look at that. And I think we're now ready to open it up and just talk about any questions that you may have. And so I'm going to now, let's see, trying to find my screen. And so let's see. We want to look at, does anyone have any questions? Q&A. Let me find the Q&A. Let's see.
I'm pulling up the Q&A right now, Sarah.
Okay.
Okay, so we already have a couple of questions. Sorry. So for the first question, Andres asked, at the Blanco Center, we've been working on dashboards to look at issues related to Whole Health Louisiana. For
Okay.
example, food insecurity, child poverty. How can communities leverage ALICE data to improve outcomes such as child poverty in their community? Do you have examples of communities in Louisiana that are doing that?
Well, that's a great question. So, first, I think one of the first steps in solving a problem is to have a real clear picture of the problem, all facets of the problem. And so we hope that those that are seeking to learn more about child poverty can leverage the ALICE data to put their arms around the scale of child poverty and the reasons why that could be happening, and also to go even further to say that what the ALICE data shows us is that a family could actually not be in poverty. A family could be Alice, and their children could be confronted with um, some really important needs that cannot be met. So one of the myths that one of the things that the Alice data clears up is your family could be not in poverty and still be very much struggling with some needs. And in this case, 50% of families in Louisiana fall in that category. What are some examples that communities that of commu that what are examples of communities in Louisiana that are doing that are using the ALICE data to improve outcomes? You know, there's a lot of things that I could point to. Um, it could range from how are communities helping Alice to increase their wages so that they can provide in a different way for their children. It could be how are families able to access quality childcare through funding supports so their children have a healthy start, have a good early care and education despite their family's economic status. That probably is something that I see many communities and even parish governments getting involved in through matches to investments in early care education. Um, and we talked about earlier how families with children are accessing free VITA tax prep help so that they can get and draw down their earned income tax credit, their child care tax credit, their all the working tax credits that they can access to put money in their pockets so that they can serve their families, and all this money goes right back into the local economy. And those are just a few examples. I hope that gives you a sense of just a few examples of things that are happening to help children in poverty.
Thank you for that answer, Sarah. Our next question is from Norman, and he said, "Fantastic presentation and data. Thank you, Sarah. Did United Way use the MIT Living Wage Calculator in this report?"
You know what? I could ask our lead researcher. From what I understand, no. It might be there's actually multiple sources that have created a living calculator, living wage calculator. The wage calculator, our wage gauge has been created by building a picture of expenses that exist in Louisiana based on public data. And so um, they have taken the survival budget and moved it into a budget that we call thriving. So we have a survival budget and then we have a thriving budget. That thriving budget probably is the comparative budget to the MIT Living Wage Calculator. What our research team did is use the public data to identify what an ideal budget amount would be to cover the basics in Louisiana. So it's very Louisiana specific. They might have referenced and looked at MIT as a model, but our thriving budget is not based directly on MIT. But the good news is there's probably a lot of similarities. Thank you, though. Thank you for the question and thank you for being here today.
Um, Someone asked, where is this information available and will the PowerPoint be shared?
I would say if it's good with Gwen, I'm good with sharing out the PowerPoint, and I also shared out a 4-page handout that summarizes the budget and some parish statistics. All of that can be shared. Now, we did put some links in the chat, and there's some links in the chat where you can directly access the report and all of the data that I talked about today and more. So I touched on uh, several aspects, but there's a lot more. And I think you might also enjoy digging into all those indicators of well being. You can get those if you cannot access the chat because you're listening to us by phone. You can access it in two places. First, you can go to launitedway.org, which is the Louisiana Association of United Way's website. We have a section of our website that's focused on Alice. You can get it there. Then, secondly, the research center that has a lot of adaptive research that's available can be found on unitedforalice.org. And so it's very adaptive. You look for Louisiana's research and you can find it there. And look, save it on your desktop. Use it as much as you want. Reference it in your papers, your case studies, your white papers, your speeches, anything you want to do to help raise awareness about Alice. We just really would love that.
Thank you, Sarah. And yeah, if I can definitely get my colleagues to share the PowerPoint to all the attendees today after this webinar, so we can get that handled. Yeah. The next question is, what is the most effective way to assist Alice in growing out of Alice?
So, what's the most effective way to help Alice? What I'm hearing the question say is, how do we help Alice rise from living below the Alice threshold to a place of thriving? And one of the most common ways is that we help Alice access the workforce skills to increase their wages. And so job training and workforce development is a major key to helping Alice be able to earn more with their time and their skills. And so that's we hear, and we are hearing a lot of new strategies in Louisiana to help do that. And so that's very encouraging. It's important that we help Alice complete their education. So if Alice wants to return to school to increase their skills, and we can offer them supports with childcare if they're a parent, all of those things matter. There's not just one thing we can do. There's no silver bullet. It's more of a holistic view. And what our hope is with this report and this data is that those that are privileged to be in a position of planning, policy making, strategy making, especially as it relates to the people of our state, that they would consider using the Alice data as an informant to their work and to their policy. That is a significant, though, just to summarize, increasing wages is the most simple answer. How that happens is has a multitude of answers. Yeah.
Our next question asked, is the Alice data and reporting aggregated by race?
Yes. So you can access de information with it aggregated by race. Um, you can go to the United for Alice Research Center and you can access some adaptive pictures that give you the statistics. What you're going to see there is that African American workers in Louisiana are more likely to be living below the Alice threshold. So there are systematic barriers that do place some racial groups more at risk than others, and you will see that in the data.
And Nicole asked, what steps can Medicaid managed health plans take to support mitigation of these barriers?
You know, that may be a question that I'm not equipped to answer, but I'll give a couple of thoughts. Um, Let me look at the question on the screen so I can keep thinking about it. One thing that is is access to Medicaid is number one. We know that right now there's some changes related to Medicaid that may change eligibility for some workers in Louisiana. Um, Whenever, um, if Alice lacks transportation, um, Medicaid plans that can truly provide that transportation need so that Alice can access their medical care is just one example. Having access to Medicaid when they need it is an example. Um, Employers, I know that in this research cycle, we will be taking a look at the realities of the cost of healthcare for Alice workers in Louisiana. And the cost of health insurance is very high. And it's a significant, it could be a significant part of earnings. Um, and so I wish I had more of an answer for you for that one. I don't consider myself an expert in the policy that guides the Medicaid framework, but I am encouraged that I do believe that factors, I hope that the Alice data that we have here is considered as policy planning happens in our state.
Thank you for your answer, Sarah. And we are running on time, and I know there's a lot of questions that we haven't been able to get to yet, and I apologize, everybody. But if you do have a question, Sarah, is it okay if they contact you or
Yes,
okay.
absolutely. And so I think. My name is Sarah Berthelot. You can get my email at launitedway.org or just call me. I thank you so much for giving us an opportunity to talk about Alice. Please contact me anytime, and thank you so much for your concern and care of the health and wellness of Louisiana through this initiative. I'm grateful for the Blanco Center for having me.
Thank you so much, Sarah, for presenting today. And I would just like to make a final reminder that if you are getting CE credits for social work and nursing, please complete the survey. And the link was dropped in the chat, but the recording of this webinar will also be posted on the YouTube account in 1 week. So if anyone would like to share with others or rewatch it, that will be on the YouTube channel. And again, thank you so much, Sarah, and thank you so much, Lissa, for interpreting for today's webinar. And everyone have a great day.
Thank you.